Welcome back to
The Hot Pot. I'm Princess May, aka the Princess.
And I'm Tracy, aka the DJ.
This month, we celebrate National Minority Health Month.
And National Minority Health Month is a time for us to highlight the important role of individuals and organizations in reducing health disparities in our communities.
For this episode, we want to focus on the importance of cultural competency in healthcare outreach.
Princess May, do you have any personal experience with this?
Yeah, an experience comes to mind when I was an intern at a hospital in Hawaii. I remember having the opportunity and the privilege to shadow a pediatric physician. And during this time, we were able to enter a room and speak with a patient and her son who was in a wheelchair. And during this interaction with the physician and the parent, you could tell that the parent was falling asleep, not really listening to the physician. The physician directed a lot of the questions to the son in the wheelchair, like any medications he's on, how it's going and whatnot. And I remember walking out of that room and the physician followed after and then spoke with the nurses and said, "This mother in this room does not care at all what's going on with her son. Like, she needs to focus more. The son was answering all of the questions. She's falling asleep." And so we were right outside the room and I'm sure she heard. A couple minutes later, we walked back in and immediately the patient's mom said, "Oh yeah, I'm falling asleep because I worked until midnight last night. We took 3 hours on the bus to get here." And I remember this experience particularly because I remember just thinking, this is a population they typically serve. They know that people take hours on the bus traveling to get care, and it's an outpatient clinic. And the physician knows too that this is the population they're serving, and the lack of cultural competency and understanding really got to me. And it's a story and an experience I continue to carry with me today. Tracy, do you have any experiences you like to share?
Yes, I do. Mine's a little bit more positive. So it's borrowed from my sister because she's a physician and she was working in West Virginia at the time. And one day a baby came in and their parents couldn't speak English very well. But luckily my sister was working that day and she also spoke Mandarin Chinese, which is the language the parents spoke. And she was able to communicate with them. They were, of course, super worried. And she even gave him her personal number, and they contacted her quite often just because they were new parents and they're just really worried about their baby. And I think you could just tell how appreciative they were that she was able to communicate with them, and just to see a physician that looked like them and understood them and their culture, I think was a really positive experience for both of them and both sides. And I think one of the reasons why my sister kind of really cared about this patient and their family is because, as many people can relate, immigrant children have to translate for their parents many times growing up. But as my English was surpassing my parents, which didn't take a long time, I remember being in restaurants or accompanying my mom to the doctor and kind of just having to translate for her. And some doctors were really short and you could tell kind of annoyed. And so I think my sister took that experience as well and made sure they were really seen.
I think a lot of the stories that we shared and the experience your sister had and growing up and you had, it's that's how we apply it to everything we do now. It's how can we be better, or how can we teach others nowadays to be better, especially in healthcare? Now that we've shared our experiences, we're going to hear from our guests. Hi, Dr. Singh. Thank you so much for joining us today. We're really excited to have you here on the Hot Pot and to highlight some of your important work. To start us off, can you introduce yourself?
Well, thank you so much for having me on the podcast. I feel really privileged and honored. And my name is Vasu, and my last name is Singh. I'm a primary care physician. I do practice family medicine in Bethlehem, Pennsylvania. I have been involved with the organization AAPI, which is American Association of Physicians of Indian Origin. This organization is based in Chicago. And we have over 80,000 plus physicians of Indian origin, and the organization is a platform for them. Plus, we have 40,000 plus medical students, residents, and fellows of Indian origin in the United States, and the organization is a platform for them as well. So my role in the organization is that I've been involved with the local chapter in Lehigh Valley, which is Allentown, Bethlehem, and I've been president of the organization. But last year I was elected as regional director of Mid-Atlantic 2, which is New Jersey and Pennsylvania. So my job at present is to connect my local chapters with the national organization, and also make sure that all chapters are on the same page, and then we are promoting the agenda that national API has. So basically, we promote health, well-being, preventive medicine, and of course, advocacy.
Thank you, Dr. Singh. Yeah. Thank you for sharing a little bit about you and your organization. This episode, we're wanting to cover cultural competency for AA and NHPI communities. So what does that mean to you?
So cultural competency, if you ask me, it's a very broad term, but yes, it's a very fascinating concept to me. And in my opinion, cultural competency is to understand and to be open, to be able to learn about other cultures and where these cultures are coming from, what values they have, what belief systems they have. What is the history and what family means to these cultures, what are the religions, what do these people eat, how do they live. So to me, everything sort of, that sort of constitutes the cultural competency. And also keep in mind, there are so many cultures in the world, and it's not possible for all of us to learn and to know each and every culture. But I think as long as we are open, we are willing, and we are able to adapt and to adopt, I think that to me is the most important thing in this entire concept. And be respectful to each other. We should not be judgmental, critical, and no stereotyping at all. So that's how I look at it. I mean, I'm sorry, it's a very broad concept, hard to put it in words in a sentence though.
No, that was perfect. And I really love that you emphasized how important it is to just be open about different cultures, because there's no way one person can know everything going on with a patient or one individual.
I agree.
And so leading to that, why is cultural competency important in healthcare?
So to be honest with you, I think that cultural competency it's relevant and it's important in every workplace or even non-workplace, even in our social settings. If I'm in a group of 10 people, I think if we are all culturally competent, it makes everybody's life and job easier. But when we talk about healthcare, it definitely, I think there's a lot that we can discuss, because healthcare, keep in mind, we are dealing with live bodies. There's a lot of human interaction that's involved in healthcare. We are a lot of emotions, a lot of empathy. There's disease process, which could be acute, which could be chronic. There are a lot of factors that are involved in healthcare. So I think in healthcare, that's why the whole concept of cultural competency, it's extremely valuable and very, very important. And also to keep in mind, there are certain other important factors. For example, we talk about lowering healthcare costs, right? So your healthcare outcomes are also directly related to the cultural competency. We know this for sure, that anytime we have culturally competent teams that are taking care of patients, the healthcare outcomes are always better. They are improved and they are better. So I think those are some of the important things. And also keep in mind that utilization rate, for example, if teams are healthcare providers, if we are culturally competent and we are taking care of our patients in a culturally sensitive manner, we can also not only improve the outcomes, but the utilization and the healthcare cost can be managed as well. So I think that's why it kind of, it's a very important, keeping the rising healthcare cost in this country in mind. I think this concept actually plays a very critical role there as well. And also, I just want to bring up one more point, that it's not only the interaction or the cultural competence towards my patients. I have to also keep in mind that, the team that's working with me, because these days, as we know, the United States is a melting pot, and the rate of people who are non-English speaking is growing. It's unprecedented level. It's growing so fast. So we have to be we have to keep everybody around us in mind at workplace too. So I'll give you my own example. I work in a setting where I have people who speak Spanish, people who speak Urdu, people who speak Punjabi, and of course, the English-speaking population and my colleagues. So we all have to be respectful, and we all have to be culturally competent, even within our work.
Yeah, thanks for bringing up that there are many layers to cultural competency, especially in healthcare. And I know you touched upon this a little bit in your answer, but how can we improve cultural competency for API communities in healthcare?
Sure. So if, again, we can maybe break this question, because there are different levels of communities that we are dealing with, right? So say if there's a group of new immigrants, they have just arrived from a country. So if I have to think and to improve the cultural competency in that group, I will have to use different interventions. Whereas if it is a group, a different group, which is culturally, they don't have health literacy issues, and they are on the other side of the spectrum or the curve, I will be dealing with that group with different interventions. The concept will be the same, but my interventions, the tools that I use will be different. So for example, say if I have a group of people who have just arrived from India, for example, right? And this group is not very, linguistics is a problem. They don't speak English. But yes, they all gather in a same worship place on a Sunday morning. So I think that's where we should be focusing our interventions. So I think as long as we do some needs assessment, we learn about our communities, and then we design our tools, interventions that will be helpful. So I take my resources to these communities and try to educate them, the health literacy, and introduce small interventions, and then try to make sure that these communities can then assimilate easily into the mainstream. And then, of course, the larger organizations, I think they play a very important role when we talk about promoting cultural competency. I'll go back to an example. I work in healthcare, deal with hospitals, and it is very important. It's fascinating to see actually that how most hospitals, whether they are small size hospitals or larger organizations, they've made sure that their staff and their everybody's periodically trained in cultural competencies. Some organizations I've seen that they in fact do timely assessments, periodic assessments, where they gauge where their population falls and what are the needs of their community, and they design those interventions accordingly. So I think that's very fascinating. Recruiting, for example, when we are hiring people, I think if we make sure that cultural competency is a core, it's one of the highlighted requirements that that we would appreciate if our staff is willing to be culturally competent. So that's an important intervention to me as well. And trainings, frequent trainings on staff, on site, and of course training our managers in the bigger healthcare organizations. That certainly helps. And celebrating each other's simple things, like celebrating each other's festivals, be respectful to their religious preferences, choices, If somebody wants to have a day off on a Diwali, which falls on a Thursday midweek, I think I should allow my staff member to take a day off, and I should respect that this person celebrates Diwali. Why not go have fun today? So I think as long as our managers and our bigger organizations, they are they do their needs assessment, and based on that, if they design their interventions, that's helpful.
Great, thank you. I really loved everything you shared, and what I really picked up on is how important it is to listen to the community, train future physicians or people in healthcare, and really just being understanding with different cultures, like coming into the workplace and working with different communities as well. So all very important work that you're doing. What are some barriers to care that you've experienced in your own work for AA and NHPI communities?
Okay, yes, so that's a very good question, and we can talk a lot on barriers, but I'll be short here. So when we talk about barriers, if you ask if I have to give you my own example, what I deal with on a day-to-day basis is, again, linguistics, number one, health literacy, number two, and the cost of healthcare, the rising cost. Those are the huge barriers, in my opinion. And then, of course, we can talk about the social determinants of health, which is relatively, it's a newer term. I mean, when I got trained back in early 2000s, we knew that these are the barriers, but these barriers were not, they were very loose. But now we have them all bundled under the social determinants term. So social determinants are very important to be kept in mind as well, which again, that means that if I have to treat a patient, say if somebody has diabetes, and if I see a patient, I can write a script very easy. I can hand this patient a lab order script and a prescription, and then send him out of my office. But I don't think so that's a good way to practice medicine, right? Because again, there are a lot of other steps that are involved till this patient goes to the pharmacy or to the lab. So I have to make sure that my patient is able, can he afford, or does he have means to go to the lab or to the pharmacy to pick up his prescription, whether he can afford, or if he can talk to the lab what he actually needs. So all those factors, they come under social determinants. And for example, your transportation, your social support structure, your access to resources, and whether you have access to good, healthy food. Again, going back to my diabetes patient, if I don't know my patient, if I don't understand my patient, I can just write a script and send him home. But if he goes home and if he's consuming 3,000 calories that's coming straight from carbohydrates, that's not gonna, I can never be able to bring his A1C to the desired optimal range, right? So those, so I think when we, going back to your question, so when we talk about barriers, yes, language, affordability, and again, the whole social determinants, whether, patients have access to healthcare or not, whether they can afford healthcare or not, whether they have a social structure around them, they have family. I mean, if somebody's depressed, do they have that kind of, family network that can support them? So all those factors are important as barriers. So that's what I would, and I think those are very important needs. And if we don't fix the social determinants, I don't think so we can manage diseases that well, and the healthcare cost is going to continue to rise.
Yes, I love that you brought up social determinants of health, because they're so important. And I'm so glad that as a physician, you understand that and can look at a patient in that more like holistic way. Not just like them singularly in your office for that visit. You kind of go deeper than that, which is amazing. Is there a way that community members can seek out culturally competent physicians, especially in a less diverse area?
Yeah. So that remains a huge challenge, right? Because again, and I'll again, going back to where I practice in Bethlehem, Pennsylvania, I'll give you my own example here. So it's difficult because sometimes it's very hard to find providers who can match patients' needs sometimes because of the shortage healthcare providers. But I'm glad that recently, because of, so in a way, the whole pandemic, how it sort of led to the telehealth platform and medicine. This has been a blessing to all of us, that we can use such platforms to overcome these barriers and mitigate these problems, right? So it was very difficult. So for example, for my diabetic patients, my hypertensive patients, if I have to refer them to say diabetes educators who are culturally competent, who know that what are the dietary needs of my Chinese patient, or what are the dietary needs of my Indian patient. I had difficulty finding those providers before, but now, thanks to the whole telehealth platform, that we can connect with anybody anywhere in the world, and that has been a blessing for a lot of my patients, in fact. So it's to answer your question, yes, it was difficult, but now, because of the whole telemedicine, telehealth concept, the virtual visits, I think we can overcome this barrier as well. So we can find providers or healthcare workers or counselors, for example, mental health. So we can find people who are, I shouldn't say people, you can find healthcare providers who are culturally competent via these platforms.
Thank you. And thank you for sharing and promoting telehealth. I found it so much easier to access care, and I really enjoy being able to access a physician through using telehealth. So
yes,
great.
I completely agree. And I've always been a big proponent of telehealth, because when I have to bring patients in for example, lab reviews or to go over their numbers, I don't think so those people need to be in the office setting, because I know my patients well. I know them. We establish bonds, and we know them very, very well, and very thoroughly. So I think a lot of those problems, they could be managed via telemedicine. But again, somehow, as all of us know, that it just took us a very long time to get to the utilization of these tools, but I'm glad they're here, and I don't think so they're going anywhere now. So because I'm comfortable, you're comfortable, so they're going to stay forever.
Yes, hopefully.
Yes.
Do you have any closing thoughts that you'd like to share before we close out?
Well, I think yes, we have done a lot of work by promoting health education and cultural competency. But again, there's a lot that needs to be done, and all of us need to be working towards this goal. And wherever we find opportunities, and these things, they start at home. So we need to make sure that our children who are young, they are trained to be culturally competent. And so we need to start. These discussions should actually start from your kitchen table. And then that's what I would recommend, that cultural competency is a very important tool, and it's a very important skill, and it should be part of each and every curriculum, no matter where we go, elementary schools, colleges, all workplaces. And as I just shared earlier, that United States is a melting pot, and we are the immigrant population is going to increase. And so I think as long as we are all nice to each other, that's good.
Yeah, thank you for that reminder. I know that we were more honed in on healthcare, but to your point, yeah, it starts at the dinner table and those conversations, and we all have a part to play in just being understanding and open-minded and respectful of where we each come from.
Yes.
Yeah, thank you so much, Dr. Singh, for being here. We really, really enjoyed chatting with you.
Thank you. Thank you so much, Tracy. And thank you to Princess.
We're so glad we got to hear from Dr. Singh and her thoughts on cultural competency.
Now that we've heard from a physician, let's hear from a community health worker. Hi, Jake. Thank you so much for joining us on the show today. We're so happy to have you, and we're really excited to highlight your important work. To get us started, could you spend some time introducing yourself?
Hello, yes, I'm Jake Fitisemanu. My full-time job, I guess you could say, is I'm a dad to two little girls and a husband. We live here in West Valley City, Utah, of all places, where I also serve on the city council. And I really love civic engagement. I love the intersections of policy and infrastructure in the way that it affects our health and social determinants of health. And so my background in academia and in my professional life is in social sciences and social studies, as well as public health. And so I currently work as a community health program manager for our largest healthcare system here in the Intermountain region, Intermountain Healthcare. And I'm also the chair for the Pacific Islander Health Coalition, which is our largest Pacific Islander serving health organization in the state of Utah, going on 11 years now that this organization has been doing some great, fantastic work. And yeah, that's pretty much me. I love being engaged in the community. I love public health. And I really appreciate the vibrant cultural upbringing that I'm blessed to have had in my life. And so I try to get involved with cultural things. I coach our Chinese lion dance and dragon dance club here in Salt Lake City as well. And so try to stay connected to my Asian American side as well as my Pacific Islander side.
It sounds like you have a lot of rich experience to draw from. We had previously talked to a physician, but we wanted to get kind of a community health perspective too. So what does cultural competency mean to you?
I think there are different perspectives on it. For me, I think what it really boils down to, in my view, is cultural humility. I think for me, it's the ability for a healthcare practitioner, a provider, a caregiver, or even a public health practitioner to recognize that we have been socialized in a specific worldview, that we have specific biases, that we have specific assumptions, and that we look at the world in a certain centric way. And cultural competency for me is the ability, is the skill, really. It's something we have to learn. It's something we have to practice. It's a skill that allows somebody to kind of step back and say, okay, just because this was the world or the worldview that I was socialized in doesn't mean that my patient or my client or the individuals I'm working with share that same worldview. And so being able to recognize those nuances and also being able to form relationships based on mutual respect and effective communication. I think all of those things, for me, define what cultural competency is. And it's not easy. It's not something that we're born with, because we're socialized in a very specific way. And to be able to step back and acknowledge that that may not be shared by the people we're working with, and then being able to proactively establish relationship of trust and build effective communication channels. I think those three things for me is kind of what the basis of cultural competency would be.
Yes, thank you for sharing. It's also just so important that in our roles and whatever work we do, that we're always open to learn from others as well, and just being willing to understand that what you mentioned, like how we grew up, we're not surrounded by all the same people all the time. We'll go into new places and new roles and learn from new people, and being willing to learn and respect and just have a greater understanding. Yeah. So in healthcare, why is it important to have cultural competency in healthcare?
I think it's crucial in healthcare. And while I say that, it's so much easier to say that. It's easier said than done, because our Western clinical health institutions and healthcare systems are really are not built to serve, it's not flexible enough to really make each healthcare intervention or encounter tailored to each individual person. And although we like to think that it is, and we hope, and we know that there are individual people, providers, components, within the healthcare system who definitely do take that extra step and go the extra mile to make sure that every individual encounter with the healthcare system has some aspect of customization or personalization. The system as a whole is designed to really get people in and out on a very broad scale, right? We're talking about serving millions of people in a state or in a county or across the nation. And so it's crucial in that those overarching policies and those systemic and institutional infrastructure, even though we need to be able to process at that level, it's crucial that our individual interactions with people are accessible and are effective, because when we're able to engage one individual, we know that we're also part of families or part of cultural groups or neighborhoods or communities. And if we're able to provide culturally responsive and linguistically appropriate services to one individual, that may actually be able to improve health collectively, or community population-based health, because we also are part of other communities, and we can then either recommend, or if it's a bad experience, they're not going to recommend, right? To the, oh, don't go to that hospital, don't go to that doctor. And so it's critical that all of our, especially because communities of color, underserved communities, lower socioeconomic communities, for example, are more prone, are more predisposed to health disparities, right? And to late stage diagnoses and more serious social determinants of health. And so if we're to engage those communities and those populations, and if we want to actually address health disparities in those kinds of communities, we have to ensure that our system actually addresses that and is proactive in providing those kinds of culturally competent services and interventions.
And do you have any ideas on how we can improve cultural competency in healthcare for A and HPI communities, either at an individual level, as you mentioned, or something more systemic?
I think the way we improve that is actually providing our caregivers and providers and practitioners with real-world experience in communities that they're not familiar with. And so I say that because as somebody who has provided these kind of trainings before, as somebody who has been a student of these kinds of trainings before, the traditional way that we do it in healthcare, right, is like a workshop or an online module, and it's very theoretical. It's very classroom based. We're sitting in an auditorium listening to a presentation about how to interact with people. Well, the way that we can actually learn cultural competence is by working with actual people, and not just our colleagues, turn to the left and have a discussion about this theoretical experience of meeting somebody with a certain religious dietary rules, and how would you then help them adjust their diet because of their health condition, or this person with specific cultural beliefs. And instead of talking about it as vignettes or as classroom modules, I really believe that getting out in communities and providing time off for our doctors and nurses and frontline staff to actually interact with people. And we can do that through mutual service projects with community organizations that serve individuals who we might not always see in the clinic all the time. And so I think that's one great way to do that, is to actually have folks from the system go into communities rather than just ask guest speakers and panels to come into the hospital or come into the public health center and talk to us about it. But I think we should be about it and provide more opportunities to be in communities.
Definitely. That's a great recommendation. It just brought me back to working in the hospital and having to do some of those modules, and I would just click through, because sitting there, it's when I'm in the, when I'm actually working with people, then I'll have the ability to learn more. And so it's a great point. It's you learn online, but then being able to do and interact is so important. I guess in your own work, what are some barriers to care that you have encountered for AN and HPI communities?
Interesting. I think the biggest barrier that comes immediately to my mind is the issue of data aggregation, or lack of disaggregation. And so here in the state of Utah, our public health department back in 2009 decided to follow the federal OMB format of breaking out Asian Americans and Pacific Islanders separately. Prior to that, it was just an API category for most of our health indicators, academic and educational data, and all of those type of indicators. And what that did was it really opened everybody's eyes to disparities in Pacific Islander communities that were being shielded, that were being concealed because they were lumped together with a much larger, proportionally larger Asian American population, which although there are many serious health disparities in our Asian American communities as well, overall, the health status of our Asian American population, life expectancy, diabetes rates, obesity rates, etc., we're much better. I don't like to use the term better or worse, but that's the easiest way to describe it. And when the health condition of one community was, comparatively higher than the other, it kind of washed it out. There was a data invisibility factor that was happening there. And so when those communities' data were disaggregated, then we realized that Pacific Islanders had the highest adult and adolescent diabetes rates in the state, the highest overweight and obesity rate in the state, the highest infant mortality rate, the lowest prenatal care rate. And all of these things were shielded previously because we just reported them aggregated as Asian/Pacific Islander. And so for me, that's a big barrier. It still exists. There's still some data sets that are not disaggregated, and there are still research studies and other programs that are not reporting as granular as they could be, and that's a barrier because it doesn't provide us information to make good policy decisions and intervention decisions. I think another one is the fact that we tend to homogenize communities. Our Asian American community is not monolithic. We just say Asian, and we often don't acknowledge that there are literally dozens and dozens of languages and worldviews and religious beliefs and faith-based systems, and these communities are not the same. And so I think when we talk to policymakers, when we talk to folks who work in infrastructure, it's easy, it's convenient to talk about these labels like Asian American and Pacific Islander, but we need to do a better job of educating folks about the nuances and the distinctions and the differences within those categories as well. And so I think that's another barrier that we face, is just public perception of the model minority. And, we just see East Asian populations doing really well, graduating, going to college, owning businesses, etc. And then we often neglect, to look at folks from South Asia or Southeast Asia and other communities where those same metrics of success, may not be comparable as well. So that's another barrier, I think.
Yeah, we can definitely relate to that with our COVID outreach. I think it's really difficult finding good disaggregated data and kind of informing our approaches to community engagement because we just don't have the data, which is really difficult.
Right.
Pivoting a little bit, is there a way where community members can find diverse physicians and community health workers in their area, especially if they live in a more rural area?
That's definitely a barrier in terms of access. Here in Utah, most of our healthcare systems, if you have access to the internet and if you're a little bit savvy, when you go through and when you look at, you can do provider search, right? And so a lot of those will provide profiles, and you can search by, well, does your provider speak Spanish or languages? But not every health system allows for that, and it's not necessarily the most convenient way either. And so for us, we try to be a resource hub, the Utah Pacific Islander Health Coalition, and we try to be a no wrong door approach either. If you come to us and you actually have, specific language needs that are not Pacific Islander, we work very closely with other chapters here that do health work, with like OCA and other groups that employ community health workers as well. And so that's a question that, it does expose a weakness, that it's, if you don't know where to go, where do you go? And so I think one thing we can do a little better is maybe work more closely with some of our more mainstream info sources like 211, for example, and work on providing filter searches by language or by cultural affinity or cultural identity. That's a really good question.
Thank you so much, Jake, for joining us today.
We've learned a lot, and we're really happy to have you on the show today.
Thank you. It was a pleasure for me to be here.
Great. Thank you. Have a good one.
Take care.
Bye.
Thanks. Bye. Thank you so much to all our guests who joined us today.
Yes, we've learned a lot, and I hope everyone else has too.
Be sure to check us out next month for our next episode.
See you then. Bye.
Bye.
It's the Hot Pot Show, don't you know? It's Princess and Tracy. It's the Hot Pot Show, it's time to go.